Hello everybody, this is Dr. Yel'Ora. You can see I'm still bundled up. I just got out from work and it's frigid. It's very cold here. It's like 6 degrees. So while I warm up my car, I'm just gonna make this video because I want to talk about resident job search. This is the time of the year when resident physicians start looking for jobs because they're going to graduate June of this year. And my residents have been asking me, Dr. Yel'Ora, what do we do? What should we actually be on the lookout for while searching for a job, especially if you want to work nights? So I have 5 things you should consider. 5 if you want to work the night shift as a hospitalist-nocturnist, which pretty much is a doctor who takes care of patients in the acute setting, in the hospital setting, but overnight. So number 1 tip that I have that you should look out for is you just have to examine yourself. Look within yourself and see if you feel like, you have the clinical competence, do you have the confidence to work at night? Because nighttime is usually very, there's limited staffing at night. So you may be alone. You may be, the only one on ground to manage a lot of acute issues. So your clinical competence is going to come into play. Number 2 is you have to find out from your, the recruiter or when you interview, are you going to be the solo hospital nocturnist? What I mean by that, are you going to be the only night physician in the hospital covering the medical service, or are you going to work with another physician? That I mean, there's going to be more than one person. Or are you going to work with a mid-level provider? And in my case, are you going to have residents, which are the physicians in training? Are you going to be working in a teaching hospital setting? The third thing you got to consider is, do you really want to work in a large or medium or a small hospital setting? And by large, I mean, you may have to consider, are you interested in working in a level 1 trauma center? And when you hear about level 1 trauma center, most times these are tertiary institutions. These are big hospitals that have comprehensive resources and have an in-house trauma surgeon in addition to a lot of subspecialists, right? So in this situation, the service is going to be busy. You're likely going to be busy also because you may be called upon to do a lot of consults at night for this critically ill patients, depending on what the clinical scenario is. And also with that, you probably will need to, you may also need to receive patients at night. It may be a transfer center. So there's going to be patients being transferred from smaller hospitals into the larger tertiary institution. So this is going to kind of affect your workflow. So it's good for you to know whether you want to work in a level 1 trauma, level 2, level 3, level 4, or level 5. I work at a level 2 trauma center, right? These are things you should consider. The 4th thing you should consider also is you want to consider what is the scope of your coverage. Are you going to just be an admitter, somebody who does admissions, or do you need to do cross coverage? Meaning, are you going to take care of patients that are already admitted on the floor? If the nurses have any concerns, they're going to call you. In some hospitals, the nocturnist handles admissions, and then the cross coverage, the person who takes care of the patients that are already admitted is contracted out to a virtual hospitalist, somebody who does tele-nocturnist, somebody who is at a remote site but communicates with the nurses. So these are questions you should ask. And then the next thing you should be concerned, the 5th point I have for you is, are you going to be involved with rapid responses, which is like a situation when there's an urgent, an acute medical emergency, and the nurses are concerned that the patient may not be doing well, but the patient still has a pulse and patient is still breathing, but there's a change in the clinical condition. We call it rapid response when that situation arises. Are you going to be covering a rapid response in addition to a code blue? Code blue pretty much means that there's cardiac arrest and the patient is in cardiac arrest. In some hospitals, the cardiac arrest is covered by the the emergency room, staff. And as a part of this whole setup, you also need to know whether the hospital has a closed ICU versus an open ICU. A closed ICU is a setting whereby the ICU is managed by the critical care physician and his own staff. He has like people who are assigned to work in the ICU, and you don't get involved in taking care of those patients. In addition to that, you don't admit patients into the ICU. So if that is the case, the ICU staff admit their patients directly from the emergency room. So the communication is between the emergency room physician and the ICU staff. So technically, in a closed ICU setting, you're just going to manage. If the hospital has a closed ICU setting, as a night physician, you just take care of patients who are admitted to the medical floor or the cardiac floor. Or maybe if you also handle the step-down unit, which is like an ICU step-down. So these are all questions you need to get clarification when you interview. To me, these are the 5 main pointers, and these are facts that, these are like tips and things that you need to consider. You need to have clarification on this because it's going to affect your workflow and probably your overall happiness working at night. Okay? And I forgot to mention one more thing. Also consider whether you want to work in an urban center, like a hospital in the city versus a suburban hospital, or maybe in the rural area, because you need different skill sets. If you work in the rural areas, you're probably going to need to be very competent with procedures because you may not really have all the backup and the subspecialty support. Okay? And if that is the case with you, then you're going to have to but you're going to have to negotiate a higher salary if you work in a rural setting. Okay, so this is Dr. Oredo. If you have any other comments, anything I forgot to mention, please add it to the list. This is like interview season, and I really want for you guys to land and accept the job that is going to make you happy. Okay. I always say that irrespective of the shift that you cover, whether you do daytime, alternating shift, or night shift, always look for the shift that will give you that feeling of happiness. Happiness is a feeling, right? And also financial freedom. That is going to lead you to financial freedom because you need to sync both of them in order to, enjoy your life in this world. That is my opinion. So this is Dr. Oredo, Dr. Yel'Ora. Thank you and bye-bye.